Hi there, my name's Cori Hammond and I am the Director of Prevention Services at Partnership to End Addiction. For this video, we're going to be diving into a crucial topic, how to help a friend who is struggling with addiction. But before we get started, subscribing to our YouTube channel by clicking subscribe and ringing the bell is the best way to stay up to date on our latest educational resources created by parents and professionals, and to stay connected to our community. Addiction affects not only the person using substances, but also everyone around them, especially close friends and family. If you have a friend who's struggling with addiction, it's natural to feel overwhelmed and unsure of what to say or how to help. It can feel like watching them walk across a fragile, swaying bridge. Each step they take is uncertain, and you're standing at the edge, desperately wanting to reach out and steady them, but knowing that if you push too hard, that bridge might collapse. It's a delicate balance of wanting to help, but fearing that you might make things worse. But today, we'll walk you through some steps that you can take to support your friend in a caring and effective way. First, let's talk about recognizing the signs and symptoms of a problem with alcohol or other drugs. You might notice that your friend doesn't look like themselves anymore. Maybe they've lost or gained a lot of weight, or you can tell that they're not sleeping. They might also start acting differently, like becoming more secretive, not showing up for things that they used to be responsible for, or suddenly hanging out with a new crowd. Emotionally, they could be moodier, more irritable, or just seem like they've lost interest in things they used to enjoy. If you see these signs, it's a signal that something deeper might be going on, and it might be worth checking in on them. Next, when you're ready to approach your friend, do so with compassion. Choose a time when they're sober and when you can have a private, calm conversation. Once you've opened the door to this conversation, give your friend some space to talk. Listening without interrupting is really crucial. Sometimes, just knowing that someone cares enough to listen can be the support that they need in that moment. You don't have to address everything all at one time. It can help to use I statements, which express how you feel about your friend's situation. For example, you might say something like, "I'm worried about you because I don't think you've seemed like yourself lately." In contrast, a you statement might sound something like, "You're acting different and you're making your family worried." The difference is subtle, but powerful. The I statement expresses concern without an accusation, which can make your friend feel less defensive and more open to talking. Here's another example of an I statement. "I've noticed that you've seemed less interested in being with your school friends lately, and it concerns me because you used to spend a lot of time with them." The same, expressed as a you statement, might sound something like this: "You never hang out with your friends anymore and you're alone all the time." But what if your friend responds with, "I don't have a problem, I can quit anytime"? This is a common reaction, and it's important to stay calm and supportive. You could say something like, "I hear you, but I've noticed some changes that really worry me. Even if you don't see it as a problem, I care about you and I want to make sure that you're okay." This approach acknowledges their feelings while gently encouraging them to consider another point of view. After you've listened, offer your support. Ask how you can help. Maybe they're not ready to seek treatment, but perhaps they would be willing to cut back or try to take a break from their substance use. They might also consider things that they can do to reduce the risks of their substance use and ensure their own safety, such as not using alone. If your friend is open to it, suggest that they seek out a therapist, a counselor, or a treatment program. This can be a sensitive topic, so try to approach it gently. You could say something like, "I think talking to a professional could really help you navigate what you're going through." If they're worried about cravings or withdrawal, you can let them know that a doctor can prescribe medicine that can help with that. You can also provide help with resources. Maybe look up treatment centers using Safe Locator or state helplines and offer to help them make that first call. Sometimes the hardest part is making that first step, and your encouragement can make all the difference. As you support your friend, setting boundaries is crucial. Boundaries protect both you and your friend by ensuring the support you offer doesn't result in your burnout or ruin the friendship. For example, instead of lending money if they ask for it, You could say, I can't lend you money, but I can help you find resources that might be able to assist. If your friend often reaches out at inconvenient times, you could set limits by saying, I'm here to talk, but I need to make sure that I get my rest too, so I can't do late night calls unless it's an emergency. Another boundary might be related to their behavior. I care about you, but I can't be around you when you're using substances. It's vital to be prepared in case of emergencies. If your friend is in immediate danger, like in the case of an overdose, call 911 or your local emergency number right away. For those dealing with opioid addiction, having naloxone on hand can be life-saving. Naloxone, it's often referred to by its brand name, Narcan. It's a nasal spray medication that can reverse an opioid overdose if administered quickly. And there's no harm in using it, even if it doesn't turn out to be an opioid overdose. It's available at many pharmacies without a prescription, and there's even programs that can offer it for free. Lastly, it's important to celebrate small successes in your friend's journey. Even little victories matter. You can simply say something like, I'm really proud of you for reaching out to that counselor. Or spend some time doing something fun together, like going to a movie or hiking if they've been making progress. In summary, helping a friend with substance use problems involves a delicate balance of compassion, support, and self-care. Educate yourself, approach the situation with care, and set boundaries to protect both your friend and yourself. It's important to know what to do in an emergency. It's also important to positively reinforce healthier choices and celebrate those small victories. Thanks so much for tuning in to today's episode. If you found this discussion helpful, please share it with others who might benefit from it. Remember, you're not alone in this. There are resources out there to support both you and your friend. For more information on this and related topics, visit drugfree.org. Until next time, take care of yourselves and each other.